Hi, everybody. So, did you enjoy your salad? Kind of different to be eating a salad when it's below zero and cold and not summer, but it was a healthy meal. So, yeah, just want to talk about pre-diabetes. Kim mentioned I have a reason that I work in this specialty. I do have one child with type 1, so that's kind of, I'm an open book about that and kind of why I decided to change specialties. So we each have two boys, and it's been fun working together. So we'll go ahead and get into pre-diabetes. So our topic today is prediabetes and deals with type 2. I'm going to click here. Didn't wake up. There it goes.
Yeah.
So prediabetes is a condition that comes before diabetes. Obviously, the pre notates that. Means that your blood glucose, which is also referred to as blood sugar, the levels are higher than normal, but not quite high enough to be a diabetes diagnosis. According to the World Health Organization, normal fasting range for blood glucose for somebody without diabetes or a non-diabetic is 70 to 100 milligrams per deciliter. And there really are no symptoms of prediabetes. So you can have it and you don't even know it. Prediabetes and insulin resistance. So prediabetes is caused by insulin resistance. Insulin is a hormone, and it is made by the pancreas. And in these conditions, diabetes occurs when the pancreas doesn't make enough of it, doesn't make enough insulin to maintain normal blood glucose levels. So it's part of the endocrine system if you're looking at the body systems. Insulin resistance occurs when your cells in your body do not respond well to insulin. They don't use them properly. So it's like a lock and key. Insulin's the key that allows glucose to move from the blood into your cells so that you can use it for energy. And without it, it gets stuck in your blood. So it makes more insulin to complete this process. And to make up for insulin resistance, the pancreas secretes more of it. It helps maintain normal blood glucose levels, but your pancreas is getting a workout. Over time, your pancreas may no longer be able to keep up. It can't produce enough insulin to overcome the resistance. So this leads to higher than normal blood glucose levels on average over time, and really stresses that pancreas. So when this happens, you have prediabetes, and your new normal is above normal ranges. So there's a picture of the lock and key, how your pancreas secretes insulin. Go to the next slide. So how is prediabetes diagnosed? It's diagnosed with an A1C. We put a handout in understanding what the A1C test is in your packets. So this tests your blood sugar average for the past 2 to 3 months, because that's how long our red blood cells last in our body, and then it's a cycle, and they die and regenerate a whole cycle of new red blood cells. So it's a measurement over the past 2 to 3 months. And the advantage of this testing is that you don't have to do anything to prepare. It is just a finger poke. And it's pretty accurate. Your blood is more accurate than the sensors are great for convenience, but they're testing your interstitial fluid in your tissues and not your blood. Blood is usually, a better picture for us. And prediabetes is diagnosed at an A1C of 5.7 to 6.4. So anybody who is a non-diabetic would have an A1C less than 5.7. Anybody who has diabetes would have an A1C greater than 6.4. And what does it mean if you have prediabetes? It means you're at a higher risk of developing type 2. So you're also more likely to get heart disease or have a stroke. Unfortunately, diabetes and heart disease, cardiovascular disease kind of go hand in hand, and they do put you at risk. One does put you at risk for the other. So when somebody is diagnosed with diabetes, their provider usually makes sure that they're taking a statin to manage their cholesterol, and we take a close look at their lipids as well as their A1C. And a daily aspirin. I'm sure a lot of you may take a daily aspirin or a statin. Technical difficulties. There. So you may be able to delay or prevent type 2 diabetes with, maybe you guys have already been aware of this for quite some time, but with exercise, weight loss, and medication. So big parts of the puzzle, big pieces of the puzzle is to exercise greater than or equal to 150 minutes per week, moderate intensity, physical activity per day is recommended, and weight loss. If you're needing a reduction, 7% of initial body weight is recommended. So, and then there are some medications that can help lower your blood glucose levels that work with different organs in your body, not just the pancreas. Some work with controlling how much your liver gives you glucose. So different medications that you can always, ask your provider about if you find yourself with a pre-diabetes situation. So being active is one of the best ways to delay or prevent type 2. It can lower your weight and your blood pressure. So both of those things, kind of a 2-for-1. If you're going to lose some weight, you're going to decrease your risk in both areas. One way to be more active is to try to walk for a half hour, 5 days a week. If you don't have 30 minutes all at once, it's okay to break it up. Take shorter walks during the day or get up from your desk every hour and walk 500 steps. Some people will just walk up and down their hallway to get some walking in. It's harder in the winter living in Minnesota. Luckily, we have the Wellness Center is a great resource. But even going to the grocery store or Walmart is a good thing to get some steps in. And now I'm going to hand it over to Tammy for weight loss.
Okay, thank you. All right, so reaching a healthy weight can help you a lot. So if you're overweight, even a 7% weight loss can really help. It really helps your pancreas because the more real estate you have, the more insulin your pancreas needs to secrete. So losing some weight decreases that real estate a little bit and helps the pancreas not have to cover so much. So any type of weight loss can be very beneficial. And to cut calories, it's if you have diabetes, it doesn't mean you need a special diet or special food. It's not at all true. With diabetes, what you want, just like anything else, is a nutrient-dense, healthy diet that you can follow for life. So when we talked about with diabetes, you have risk of cardiac disease, maybe kidney disease, those things. When you're paying attention to your blood sugar and paying attention to what you're eating, it helps with every organ in the body. It can help prevent all sorts of different disease diagnoses. So when we teach diabetes, we teach a healthy, well-balanced, nutrients diet that you can follow for life. So if you need to cut calories, one easy way to do that is just eating smaller portions. So about a 9-inch plate, about like that, is really helpful to have in your house because when you're maybe cutting calories, you don't want to have a great big plate with just a little bit of food on it because then you already feel gypped. You already feel like, oh my gosh, this isn't much food. So if you have a 9-inch plate, it really helps you to figure out your portions. And we do have some handouts in there about the My Plate method. When eating out, I don't think any restaurant I've ever been to has regular portions. Usually they're quite large, usually on a platter. So maybe planning ahead and having someone you can split a meal with is usually enough for 2 people. Or taking half home for lunch the next day or dinner. So if you get a great big serving, you could always say, hey, can I have a to-go container? And you can pack half of it up to start with. So then you can take that home for the next day. Some good ways for cooking: roast, broil, grill, steam, or bake instead of deep frying or pan frying. And use healthy oils like canola, olive, and vegetable. These are healthy fats. So there's 2 kinds of fats. And so just low fat, a lot of that, you hear about low fat diets. Well, actually the body does need fat, but we want to make sure we're getting some healthy fat in there, which is plant-based, and we're balancing that with our saturated fat, which is animal-based. So some people like to write down what they eat in a day, because I'll meet with people and sometimes I'll have them write down kind of what they ate for the last week. And sometimes it's very eye-opening. Sometimes you're eating more than you thought. Sometimes you're eating less than you thought. So it kind of helps if you write down what you're eating and drinking to just give you, because if you think back 3 days, what did I eat? Nobody remembers. I mean, even yesterday is hard to remember what you ate. So sometimes writing it down and tracking what you're eating really helps. And then take note of easier changes you can make to reduce your calories and start there. So say, for instance, you are interested in writing things down and you're interested in maybe reducing your calories some. It's good to set attainable goals. So if you say, I'm going to eat less fried food, you don't want to say, I'm never going to eat fried food again. Because then what are you going to want? Fried food. You don't want to say, I'm only going to eat fried food once a year. You have to look at you and what is attainable and doable for you. So say you eat fried foods 3 times a week. You could say, okay, maybe I'll try to eat fried food 1 time a week. So you want to set goals that in the back of your head you're not going, I'm not going to do that. Something that makes you successful and something that is attainable. So this is a good time to look at those labels on your salad dressing. Gives you a real-time label, and we did give you some handouts with some labels. So a really simple way to know what you're actually getting in the food you buy is to look at your food labels. How many people look at food labels right now? Okay, what are some things you look at? Carbs, okay.
Number 1 thing everybody's
Anybody else? Sugar, sodium, okay. What's that? Protein? Okay, yeah.
And even if it says there's no sugar, if you look down in the bottom, fine print.
Yeah.
Lots of times there's sugar added.
Yeah.
Sugar added, so it's not always.
Yeah.
Really look carefully
Right.
at what it says.
So when we're looking at our labels, the first thing is people said carbohydrate. Okay, carbohydrate's important, but we want to know what kind of carbohydrate am I getting? Carbohydrates are made up of fiber, sugar, and starch. So carbohydrates aren't bad or good, it's what kind of carbohydrate am I getting? So what we're trying to do here is we're looking at added sugar. You'll be surprised how many products they just add sugar for flavor, because sugar is addicting. We like sugar, it adds flavor. So if we're thinking about our carbohydrates, we want to see how much added sugar am I getting in this product. So 5% is considered low, 20% is considered high. And that is on your handout in your packet. But so when it comes to added sugar, you want to try to keep that on the low side. So say you're picking out yogurt. That's one that surprises a lot of people. Say it's the fruit on the bottom yogurt. If you pick that up, you're going to see there's a lot of added sugar. More sugar than fruit. But then if you picked up a yogurt that doesn't have fruit in it, say a vanilla, you're going to see less added sugar. So with carbohydrates, then we want to look at the fiber. Am I getting any fiber from my carbohydrate? So an example is, say you had a donut for breakfast. Your blood sugar would go up really fast and it would come down really fast. As opposed to, say you had some whole grain cereal with some milk and say a breakfast meat. It would go up slower and come down slower. Reason being is because foods with fiber take longer to digest. So it goes out into your bloodstream slower and it comes down slower. So you don't get these peaks and valleys. So a good way to not stress your pancreas out is to watch these added sugars and watch the fiber. So what you're going to want to do is look at even bread, cereals. You'll be surprised at where added sugar is. Yeah, a lot of bars. So it's a good idea to take these labels with you when you shop, or take a picture of it with your phone so you have it and you get used to it. So a great way to not spike our blood sugars up and down is when we're picking out carbohydrates, look at the kind you're getting. Because the total carbohydrate doesn't tell you that. So look at the fiber and look at the sugar. Sodium. Nobody needs excess sodium. So no matter if you have diabetes or any other disease, and it can prevent it, is if you look at the sodium in food, this one happens to have 37%, very high in sodium. A lot of processed foods are very high in sodium. So just kind of taking a look at that sodium and make sure you're not going over 20%. Saturated fat, most things will tell you about the fats. So they're saturated. This one doesn't have the monounsaturated on it, but in your handouts, there is a label in there that does have monounsaturated and polyunsaturated fats on the label. So when you look at things like nuts, avocados, seeds, plant-based dressings, plant-based oils, those are really healthy fats. And what healthy fats do is they make you feel satisfied. They help lower the bad cholesterol, raise the good cholesterol, and help lower triglycerides. So overall, healthy fats are a really important part of the diet, especially if you do have high cholesterol or high triglycerides, and to prevent getting high triglycerides and cholesterol. And here it tells you one regular drink, 4, 5, 6, 7, 8, 10 teaspoons of sugar in there. So if you drink regular soda, that might be a good place to start. Is, say you have a couple regular sodas a day, maybe trying to reduce that to 1 and then none, because it's really just putting straight sugar into your system. And other words for it are brown sugar syrup, corn syrup, modified cornstarch, molasses, honey. There's a lot of different names for sugar. But looking at that food label, you can see how much added sugar is in here. So you can look at any food that you pick up and check out the sugar content. Okay, so make healthy choices. So one thing that I just said is that if you do drink regular soda, you could cut back on regular soda and maybe replace that with water. Water's a great hydrator overall. If you don't like plain waters, there's a lot of flavored waters out there. Yep, and there's tons of drinks, but be careful about the added sugar and sodium. A lot of people ask us about Gatorade. They think, oh, Gatorade is a good thing to drink. It has electrolytes. Well, Gatorade was designed for athletes that are out running and sweating. So they're losing sodium and potassium. Most of us are not doing that. We're not out running where we're losing our electrolytes. So really, Gatorade, especially the Gatorade that has sugar in it, is not a great choice because it's going to be really full of sodium and a lot of times sugar. So they do have sugar-free Gatorade, but it also still has a lot of sodium. So when you're picking out your drinks, really make sure you don't forget to look at the label. A lot of the energy drinks, lots of sugar, lots of sodium. And there's so many out there. That's why it's good to have that label knowledge. Have water or try, you go back, that's okay. Have water or try calorie-free drinks. Usually about 8 cups of fluid a day, non-caffeinated, is a good goal. It doesn't have to be all water. But if it has caffeine in it, it doesn't hydrate you. So trying to get about at least 8 cups of hydrating fluid in a day. Include at least 1 vegetable every day. Choose salad toppings wisely. The calories can add up fast. And then choose fruit instead of cake, pie, or cookies. We're all going to eat cake, pie, or cookies. Even us dietitians and nurses eat them. But it's how much and how often. Are you eating more of that than you are of nutrient-dense food? So you got to balance that out. And the diabetes plate method. So in your handouts too, not the PowerPoint one, but on the other side of your folder, there is a diabetes plate method. And it's the one I mentioned earlier, where it shows you a plate, and it'll show you what foods and what portions to put on that plate. So that one is in there for you. And it's called the plate method because they used to have the food guide pyramid, remember that? It's kind of confusing for people, like how many servings is this or that, but the plate method shows you what servings on your plate should be. So it really talks about filling half your plate with non-starchy vegetables. So the starchy vegetables are like the winter squash, potatoes, parsnips, pumpkin, that kind of thing. But all of the other vegetables are non-starchy. They're very good for us. They have lots of fiber, filling, and they don't affect our blood sugars. So if you're going to have, say, a carbohydrate, say potatoes, you would have 1/4 of your plate be your carbohydrate, 1/4 of your plate be protein, and then the other half, some non-starchy choices. Then you've got a combination, so you're slowing how fast you digest food. You've got all that fiber in there, and you're not missing out on any of your food groups. All right, we can go to the next one. So this kind of gives you a picture too. We've got our carbohydrate, which is the rice. We've got our protein, and then half our plate is with the non-starchy broccoli. So really good combination to slow down digestion, give you a well-balanced diet, and not spike up the blood sugars. If you're at increased risk for diabetes, ask your provider about getting tested at your next visit. So there is a test called diabetes.org risk test, and there's also in your folder, there is a handout that you can answer some questions to see if you're at risk for type 2 diabetes. And if you feel like you answered those questions and you are, it'd probably be a good idea to call your provider and get in and have an appointment. And maybe they want to do a hemoglobin A1C and do a wellness check just to see where you're at with that. Some reliable sources. I do recommend don't Google diabetes. If you do, you'll probably go down this rabbit hole that will be hard to get out of. And anything under the sun's going to come up. All sorts of weird information and non-reliable information. Eat cinnamon and you won't get diabetes, or eat cinnamon and your diabetes will go away, all these things. So most of the questions we get come from people Googling diabetes. So I would recommend not to do that because you aren't going to get reliable, research-based information. So some ways to do that, the National Institutes of Health, if you're interested in learning about diabetes, you go into that and type in diabetes. It will give you very reliable, research-based, true information. Another one to look at is the American Diabetes Association. So this is a great one where you can learn a lot about prediabetes, diabetes. There is something called the Diabetes Food Hub too that gives you lots and lots of great recipes. And it tells you what food groups are in the recipes. It tells you the amount of added sugar. It just gives you all sorts of ideas. And even if you don't have diabetes, like I was saying before, a well-balanced, nutrient-dense diet is the way to go for everybody. And this would give you some good recipe ideas too. We all need recipe ideas. Get tired of eating the same thing all the time, and they have a lot of great information there for you. The CDC is also a great place to look up diabetes. You go into the Centers for Disease Control and you can type in diabetes, and you'll again get very good, accurate information on diabetes.